Hello, hello. Welcome to Warriors Talk with author and founder Lady ReShell, where we move away from awareness towards action. It is Health and Wellness Monday, and I'm so grateful that you've decided to take this drive with us as we dive into our topic, silent killers. We're going to talk about stroke and mental health. Today's show is being sponsored by Allstate with Paula Kelly. She's located at 327 East Glenwood Lansing Road in Glenwood, Illinois. She could be reached at 708-758-3300. And we also, Emanuel Church of God in Christ, which is my church and my pastor, Michael Richardson. We're located at 3058 West Van Buren in Chicago. We are practicing social distancing. So he is doing a Facebook Live every Sunday at 10:15 a.m. You can go to our Facebook page, which is Emanuel Cogic. So it's Emanuel Cogic at 10:15 a.m. Sunday mornings until this is lifted. So I'm excited. We are at home practicing social distancing, but we are still live on Intellectual Radio. So you can go to IntellectualRadio.com. You can catch us on YouTube as well as Facebook. And we have an awesome show today. If you are tuned in, please like and share the show for me. Like and share the show. We're going to be talking about some life-changing information that's going to help save your life and prolong your life as well. So our quote for today is, when health is absent, wisdom cannot reveal itself. Art cannot manifest, strength cannot fight, wealth becomes useless, and intelligence cannot be applied. I am so excited. I have with me today Dr. Michelle, who is our healthy solutions expert. She has over 20 years experience as a family physician, and she is sharing with us information on these silent killers, which is stroke and which is mental health. And Michelle, I'm so excited that you keep coming back to share information.
Yes.
So I'm grateful for you. So how are you and your family holding up during this pandemic?
We are making it one day at a time, right? We try to focus on what we have and not what we don't have, right? And just keep moving forward, because as I tell the kids, this too shall pass, okay? Everything will be okay. So
Awesome. I'm trying to hold up. I know you have a graduate, correct?
I do. Let's see. Thursday is the last day of school. Graduation is May 31st virtually. So.
Wow. So I have an 8th grader, and they're going to do a drive-by graduation. So May 30th is the last day. So yes. So nice. I'm excited for her. And just want to get it over with. I know it's not what she wanted, but you know.
I know we have to all adjust in this world we're living in. We just kind of shift and move with it. And like I said, keep positive. We're doing some photo shoots with our graduate this week, just to do some fun stuff. Yeah.
Yes. Awesome. We got to keep them motivated. Yes.
We do.
Yes. Well, I'm excited about the show today because, like I said in the beginning, the information that we're giving now is not only going to help change lives, but it'll help save lives and prolong lives. All you have to do is just implement some certain things into your healthy lifestyle. Start living a healthy lifestyle so that, we could be more active. And when we go to the doctor, we don't have to be afraid of these things coming because we are taking care of ourselves. So again, we're talking about silent killers. We're talking about stroke for the first half hour. The second half hour, we're going to talk about mental health. And sometimes these things can go hand in hand if you're suffering. So we're going to start off with stroke. And I know that a stroke is something that I want to say most of this stuff hit African American, Dr. Michelle. Like, we hear about these different top killers. It seems like African Americans are like right at the top of the list with all of these things, but we don't have to be. Especially when we have someone like you that's on giving this information, week after week. We shouldn't have to. We shouldn't have to be dying early.
Yeah. And you're right, because every time I come on, a lot of the topics that we talk about relate right back to lifestyle changes. And so when we take control and understand that we can make changes, right? That we are in control, that you don't have to follow down the path of family members or your past family history, that we can change things, right? We can change and learn new behaviors so that our risk for those diseases decrease.
Awesome. And it's simple. We're not saying that it's an overnight process, But if it's something that you're practicing every day, incorporating new and healthy things into your life, then eventually you're going to see a change. Your body is going to thank you. So I'm excited to hear about stroke. I know that in my family, I haven't heard of anybody having a stroke, but I do know one of my friends, she had, I think it was 2 strokes. And she's still here to talk about it. She's alive and well, and you would never know. If you looked at her, you would never know that she had a stroke. But she's very vocal about, stroke awareness. And so I want to make sure that, we're at least giving people a chance, giving them the information. Now, we know knowledge is power, but applied knowledge is the key. You got to apply it. You can't just get the knowledge and then go sit down. You have to take action with what you know. So let's just start from the beginning. What is a stroke?
Right. So a stroke is decreased blood flow to the brain, right? And that happens either from a blood vessel not letting the blood go through, right, to that part of your brain, or it could be from bleeding, right, which is now the blood is going in the wrong place and not where it needs to go. And so we think of 2 types of strokes, really, which we call ischemic and hemorrhagic. Ischemic means the blood is not going where it needs to go. And then hemorrhagic means there's bleeding and the blood is in places where it really shouldn't be and not getting to the right space. And when that happens, then the brain, depending on what part of the brain that is occurring in, the brain can't do what it's supposed to do. And, stroke, I think you put it on your Facebook page. Stroke is the leading cause of death in the United States. And it's the 3rd leading cause of death, and the leading cause of long-term disability. And that is what really also affects people going forward, right? Yes, it can cause death, but even if it doesn't, what does it do to the quality of your life going forward? How are you able to enjoy those years, interact with family, do the activities that you always wanted to do? When I talk to patients, I try to get them to see why we talk about blood pressure and why we talk about lifestyle. Why is it important to you? What would you miss out on if you were to have a stroke, right? Well, how would that make you feel? And I think when we kind of personalize what that would mean to us, it can help us be a little bit more motivated about what we need to do to take control of our health. One of the, we talk about the symptoms of stroke, right? So there's an acronym called FAST, okay, FAST, and the F is for face can be droopy, the arms get weak, the speech gets slurred, and then T is for time. Time is of the essence if you're having those symptoms. And in addition to those symptoms, there's also other things that you can notice, like dizziness, headache, confusion, visual changes. But those things, we can again help prevent stroke by lifestyle changes and controlling what we are able to. One of the big risk factors for stroke is high blood pressure. High blood pressure. Blood pressure should be less than 140/90. And we all probably know someone, either ourselves or a family member or friend who has that. And we call high blood pressure the silent killer because you will have little to no symptoms with high blood pressure. You can be walking around just fine with a blood pressure over 140/90, 150/100, and you may have no noticeable symptoms. And that's one of the reasons I'm always a proponent of making sure you're checking your blood pressure, seeing your provider at least once a year, or if you have other medical conditions, more often, to monitor your blood pressure. Because you can have no symptoms at all until that moment when you have symptoms, right? I always tell patients, I say, blood pressure is one of those things, we have no symptoms until we do, right? Until something presents itself, either that stroke or that heart attack that we can't really do anything, about right away. And so that blood pressure 140 over 90 or less is key, And as you said, in an African American population, we have higher rates of blood pressure. And because of that, in addition to other risk factors, we have higher risk of stroke. And so, again, we know that blood pressure is affected by our lifestyle, right? It's affected by what we eat. It's affected by how active we are. It's affected by how much sleep we're getting, right? All of those things play a part. And I know every time I come on, I talk about lifestyle changes because a lot of the diseases that are killing Americans and killing our communities are related to lifestyle change, right? Heart disease, diabetes, stroke. Those are the top three diseases that affect our community, in the African American community, and they're all linked to lifestyle changes. So I really want to stress how important that is, to not only listen to me and get the information, but to set short, simple goals to make change, to move from where you are today and move forward. That might be, think about this week. What can I do this week to get on the path to a healthier lifestyle? And that might be something simple like, I'm going to eat a healthier breakfast. I usually will start with patients simple. I said, if sometimes it might seem overwhelming to go from where you are to really getting to where you want to be. But let's start small. Let's start with a healthier breakfast. Let's start with decreasing, pop in your day. So you just think about what the changes are that you realistically can make. And then we set short-term goals to get there. We're in this pandemic right now, and we may not be eating right. We're maybe doing more takeout, even though restaurants are closed. We're still kind of in this mode where we're eating the wrong things and not necessarily as active. And so it takes even more sort of planning to make those changes and get the family involved if you can. But because in our communities, ReShell, it's just stroke and high blood pressure are just linked. And if we can control blood pressure, then we can control the risk of stroke.
So these are things that we have in our control, that we can take control over. And if those things are if they're manageable, we know that they are. If we're managing them properly, then these are things that we don't have to worry about, or these are things that we can prolong and live a healthy life. So we talked about, you mentioned two types. It was the ischemic, and what was the other one? The hemorrhagic.
Hemorrhagic, yeah, which hemorrhage, blood, bleeding, yeah.
And so the ischemic is the clotting.
Right. Yes. In essence, the thing that happens with blood pressure is when the blood vessels are tight. We say constricted, right? The pressure of the blood going through is high. And so if the pressure is really high, you can't get blood where it needs to go. I talk to patients a lot about these things we call transient ischemic attacks, which are TIAs, right? So in the deep parts of the brain, especially where the blood vessels are really tiny, when the blood pressure starts to get high, you may not have that stroke where, oh, I can't use my arm, or I notice I can't speak, but you get sometimes these TIAs in the deep parts of the brain where the blood pressure is high and the blood vessels are already tiny, so blood can't get there. And so what we know is that those TIAs over time can lead to what we call vascular dementia. So it's not like Alzheimer's dementia. It's kind of like, boy, I used to be so sharp.
Wow.
And I just, I'm not as my concentration, my memory might be poor, but it's not something you just notice like that. It comes on slowly because these little tiny spots, and I see it all the time when we order CAT scans on patients, and it'll come back with a reading of evidence of ischemic TIAs on the CAT scan, because we can see these spots on there where there were these tiny, quote, mini strokes. You never knew it. You never had symptoms, but boy, later in life, you start to notice, I'm, just not quite as sharp, right? I can't concentrate as much. And so those are the things that we're also trying to prevent, those TIAs and mini strokes that you hear about before it becomes a massive stroke.
Okay, so we should be starting right now, taking care of ourselves so that we won't have that problem. Because I think sometimes, we delay stuff. We delay going to the doctor. We think, oh, I'm okay. Okay, the blood pressure was high a couple of times. I'm all right. But I think we don't really know what it's doing to the actual body. If you knew, then I think we would probably act fast or, stay on top of it. But sometimes, we put things off, out of sight, out of mind. We figure like, you don't have that immediate consequences for not taking care of it. So you can kind of put it off for a little bit.
Yeah, and it's high blood pressure causes kidney disease, and that has no symptoms until we go to the doctor and you check blood work and we see these bumps in your numbers, right? So we're talking about stroke and we're talking about blood pressure, but they all go together, and all the things that blood pressure can do to our internal bodies without any symptoms, right? It's causing some damage to the kidneys. It causes damage to the eyes and, what we call peripheral vascular disease, when the blood doesn't flow well to the limbs. And so all those things, I'm such a proponent of, we want you to live a good quality of life. And so you need to understand why we doctors are so we get so anxious and about those numbers, because we know what the numbers mean for your quality of life. And sometimes doctors aren't explaining it as well to their patients. We're busy in the office. We're trying to rush from one to the next. And so that's why we're kind of here trying to give that extra information to patients so they can understand what they may have missed in their doctor's visit. Here's the extra information that can help.
Awesome. So if you're just tuning in, we are live on Intellectual Radio, and I'm talking with Dr. Michelle. We're talking about the silent killers. We're talking about stroke, and we're talking about mental health. And she was just telling us that if you are managing your numbers, if you are managing high blood pressure, diabetes, heart disease, then a stroke is something that you do not have to worry about. As long as you are doing exactly what you're supposed to do, then you won't have to worry about it. You're staying on top of your doctor's appointment. You're communicating when something is going wrong, because the last thing you want to do is get to a ripe old age and you have those issues where you're not as sharp as you used to be. And we know as you get older, things do decline, but I've seen some people older than me and they're on it. They don't have those issues. At least they don't seem like they have those issues. So I think right now, take care of your body right now. We only get one tempo. And once that body starts to break down, it is so hard to build it back up. I'm telling you. So make sure that you are putting the right foods in your body. You're exercising, because that plays a role in stroke as well. What you eat, your exercise, making sure that you're getting activity. You have to be able to move around.
Yes.
As far as I'm thinking about like even drinking water. Water lubricates everything in our body, and just think about it's 60% of our water is 60% of our body. If you're not drinking, it's not lubricating all of those organs and those body parts that it should. So that means everything is fighting harder, is working harder than it should.
Yeah. When you drink more water, you're able to kind of cleanse the body of a lot of the things that we eat, right? Especially salt. Salt plays a big part in blood pressure, right? And when you eat salty foods, I think of, pizzas and French fries and burgers, then it makes you hold on to extra fluid, which then gets you all swollen and puffy, but also increases the blood pressure. And so when you start to drink more water, if you're okay to do that, of course, if you have heart disease, you want to get that cleared by your doctor, because sometimes you have water restrictions if you have severe heart disease. But for us who do not have, significant heart disease that limits our ability to intake water, we should be drinking, water with it, with each meal. Usually, to make it simple for patients, I will tell them to drink a glass of water before you drink anything else at breakfast, lunch, and dinner. So you know that you at least got that in, right? And that's still not just enough, but at least if we could start with that premise that we'll get in the water, breakfast, lunch, and dinner, then we're on the right track. And so as you mentioned, it's eating the right foods. And if you don't know what those are, if you have access to the internet, I love the Mediterranean diet. The Mediterranean diet is excellent for heart disease. It really talks about fruits, nuts, whole grains, and what you can add, to your diet slowly, right? I say, look at that list, and next time you go to the grocery store, add one or two things, so that you can start getting on that track to healthier eating. And then sleeping. We don't think about sleep as a risk factor for stroke, but it's a risk factor because lack of sleep can increase your blood pressure. Without that lack of sleep, it's a stress to the body, which then increases the adrenaline and the cortisol in our system, which can lead to blood pressure elevation. So as hard as it is sometimes, and even now, just because of the pandemic and increased anxiety and all of that, people and worry, people are not sleeping well, and may have bumps and elevations in their blood pressure and not realize it. So I encourage them, to try to get better sleep, talk to their provider about it. There are things over the counter, melatonin, that can help, but definitely getting adequate sleep is important. If they're a smoker, quitting smoking. Easier said than done. I know it is easier said than done, but what we know that we have lots of good tools to help people quit smoking. We could do a whole show on quitting smoking, right? How do you start, right? I pick a quit day, pick a support, have a plan for when you feel like you want to smoke. What will I do? Right? So I will tell patients to already have thought about that, right? If you know that you smoke when you get in the car going to work, if you're going to work, if you know that's a trigger for you, then maybe chew gum or talk on the phone or something else that you can do to kind of get past those 5 minutes when the craving hits, because studies show that if you can get past the first 5 to 7 minutes of that craving when it hits, then you get past the craving. And so they have to have a plan for that. And then there's medications that can help people quit smoking as well. And then alcohol use, limiting alcohol intake as well, can help with the blood pressure. So those are just some good tips for people to kind of take away from us tonight. You mentioned getting physically active and socially active. We're in this socially distant time, but even interacting with friends and talking on the phone and laughter, all of that can help lower blood pressure naturally and at least prevent it from becoming elevated. So I just wanted to share that information about the lifestyle things that you can do to decrease your risk of stroke. But really, if you are at risk, be able to identify the symptoms early, as we talked about, right? Changes, face drooping, arm weakness, speech issues, and act quickly, because the quicker we are able to act on those stroke symptoms, the more likely you are to be able to recover from that stroke with decreased sequela afterwards.
So I was reading somewhere, Dr. Michelle, where it said that the signs of a stroke in women is different from the signs in men. Is that true?
Mm-hmm. Yeah, I mean, sometimes we, just like in heart disease, we don't have the classic sort of typical chest pain with heart attacks. With strokes too, it can be some of those sort of nebulous symptoms, like I just feel dizzy, I just don't feel right. People will say that all the time, right? Even the thinking, issue, and we tend to sometimes write those things off, right? As we said, as age, but it can be a sign of something more significant. Yes, the classic signs that we think about is, oh, I can't use my arm, or I'm having difficulty talking. But those other kind of, I've had patients who had lost vision because of where that blood, it wasn't going. Visual changes, headaches. That's quite common with women too. We'll just have these kind of non-specific symptoms. And that's why too, as if you are living with someone, it's important to recognize changes, right? If it's not those blatant, outright signs of stroke, if you are noticing changes in someone who was always very sharp and with it, or someone's complaining of more visual problems than they had before, those are things that need to be checked out. Sometimes we just kind of write that off, but check a blood pressure, report it to your provider, because there may be something underlying going on.
Okay, I just wanted to read some of the signs for women, and you covered most of them. Nausea, vomiting, hallucination, pain, general weakness, shortness of breath or trouble breathing, faint or losing conscious. It has seizures on here, confusion, lack of responsive, and sudden behavior changes. And those are for women. So for men, I was surprised they only had drooping on one side of the face, slurred speech, difficulty speaking, or difficulty understanding speech, or arm or muscle weakness.
Yeah, that's what we normally will think of as stroke. But as you mentioned, with the other things too, women just tend to present differently. Why that is, right? The same thing with heart disease. A lot of women will complain of abdominal pain, but it's really chest pain. And that's why again, important to recognize a change in behavior, what is new, right? If you're living with someone, you want to just be aware of those things so that you can act, so you can call a provider if you need to, dial 911 or what. But I'm a big advocate too of ambulatory blood pressures. We should, if you have high blood pressure or at risk for high blood pressure, you should have a blood pressure kit at home, so you can intermittently check your own blood pressure and be able to monitor any changes.
So you talked about the risk factors, which is somebody who has diabetes, high blood pressure, heart disease, if you have a family history of strokes, and it says, we talked about the unhealthy diet, not exercising. You talked about the salts. And I know sometimes we're like, I'm going to pray over my food and I'm just going to eat and be okay. No, we really have to take an active role in our health. We really do. Yeah, you pray, but then you have to take action. Faith without works is dead. So you have to take some type of action, other than just praying. And a lot of times we don't do that. We just, oh, it's going to be all right. I prayed about it, but you got to work. You have got to work. And I just believe that with the one body that we have, just, being a cancer survivor, and, sometimes you take for granted your health. And then when something happens to weaken your health, then all of a sudden you like, oh, wow, you figure out how important health is. And, not being bothered with certain things like stress, following up with your doctor, just little things that you can do just to make life a little bit easier for you, and also for the people that you're taking care of, or the people that may have to take care of you. So we just have to be take a more active role, and not just
And a lot of times we wait for something bad to happen before we act. And we need to think of things in more of a prevention way, as opposed to waiting for something to happen before we act. I don't know if I lost you there, ReShell. Way. I lost you there, ReShell. Okay, I'm gonna wait for ReShell to come back. As we were talking about, let me just touch on foods and diet, right? A diet high in fruits, vegetables, very important. Nuts, whole grains, those are part of the Mediterranean diet. One of the best, I hate to say diet because it's a lifestyle change, really, that you can incorporate. If you want more information on that, you can find that online, Mediterranean diet. Great for heart health, blood pressure. There's so many things and fads out there that we think about. But that one has, stood the test and been proven to help with blood pressure and heart disease and all of that. So definitely take a look at that. You want to have a diet that's low in red meats, in sweets, and sugar sweetened beverages. We don't think about what we drink, but what we drink is as important as what we're putting in, what we're eating. And we tend to downplay um, the sugary beverages. I had a patient once tell me she was going through a 24 case of Pepsi per week. Not only is that, much more sugar, but if you're drinking that sugar, you're probably not drinking water. You're increasing your risk for, diabetes as well and obesity. And the increased sugar, which we could do a whole nother talk on that, um, will cause increased inflammation in the body. We've heard so much about what sugar does to us, but so those are the things that I ask patients to look at. What are you doing that you think you can change? For someone who drinks a lot of pop, I go down to how much do you drink every day? How many pops do you go through every day? If they tell me three, I said, do you think you can go down to two? I don't want to make a plan for you that's not achievable, because then you will lose your motivation and just say, forget it, right? So I usually will start with an achievable goal. So, yes, I'd like you to stop all your soda today, but what I'm going to do is say, okay, how about we go down to two every day for this week? And let's see how you do with that. Because the other thing is, if they're drinking Pepsi and having a lot of caffeine, when they try to cut down, they'll have a caffeine withdrawal headache, which again will cause them to revert back to the bad behavior and lose motivation. So you have to do it slowly. So again, set some small, achievable goals. All of that will help you on the path to a healthier lifestyle, so that you don't develop high blood pressure, or it makes it easier for it to control, so that you don't develop obesity, or at least we start working on how we decrease your weight, but making small achievable goals, right? So you may need to work with a provider to kind of talk through what you want to work on, but I encourage you today to think about that. What can you do between now and the weekend? Let's make small goals, right? Is it that I'm going to decrease my sugar intake? Is it that I'm not going to have pancakes for breakfast, and maybe I'll have whole grain toast with one boiled egg and turkey bacon? Or just figure out what will work for you. I always say too, when we talk about adding fruits and vegetables to your meal, that if we think about fruits and vegetables, they have a lot of color. A simple technique that I use with patients is, if you look at your plate and there's no color on your plate, it's probably not a very healthy plate, right? Because if you think about fruits and vegetables, they add color to the plate. So a hamburger with French fries, it's all beige, brown, it's all in the same hue, okay? You haven't added anything to that, not just the ketchup and the mustard, but actually fruits. Put some fruits on the side, maybe add some carrots on the side, or something else, so that with every meal, you've incorporated some fruits and vegetables. With your eggs in the morning, maybe add some spinach in there, or some cut up, green and red and yellow peppers or something, because it doesn't have to be that you've changed everything that you normally do, but that you incorporate into what you normally do some healthy options, right? So that's kind of where I'd like you to make some changes. Please, leave any comments that you would like, myself and ReShell, going forward. Hi there, you're
Hi,
back.
sorry, I had some issues on my end. Okay, so that's some great information. I agree, starting small, because you don't want to set yourself up for failure. So if you start small and build on it, then you'll be able to look back a week, maybe even a month from now, and say, wow, and you'll be able to notice the changes in your body. I did have a question from Vernita, and she wanted to know, going back to blood pressure, how often should you check your blood pressure in a day?
Oh, so if you're just doing screening blood pressures, you may not have high blood pressure. I would recommend screening once a day in the morning, and to see where you're starting out. Some people have higher blood pressure in the morning. So check once a day. If you are someone who has high blood pressure and you would want to know how certain things affect your blood pressure, right? You're already sort of managing and struggling with that. Check it in the morning, and then check it sometime later in the day, in the afternoon. That tells you, okay, here's where I started. What did I do today? What did I eat today? And then by 3 or 4 o'clock, if you check it and it's high, you can then kind of think back to what did you do? Were you active? Did you eat pizza? Because the only way, knowledge is key. And then if we know that certain things affect our body a certain way, then you can tweak and adjust that. And so that's kind of what I would recommend. Once a day, if you're just kind of monitoring and you want to know, maybe you're at risk, or not even, you could do it every other day. But if you have high blood pressure and you want to understand what's going on with your body when you eat certain things, when you're stressed, when you didn't sleep, check it different times, morning and then somewhere in the afternoon, evening.
All right, if you are just tuned in, we're talking about the silent killers. We're talking about strokes, and we're going to transition over to mental health. Again, we are live on Intellectual Radio. I have Dr. Michelle here with me, and she is sharing her wisdom. I hope you guys have your pens and your pads handy and that you have been writing stuff down. If you have any questions for her, please put the questions in the comments so that she can help you. Again, we are trying to change behavior so that you can live a healthier lifestyle. And you're going to start with small baby steps. So we know that sometimes if someone has a stroke, it can cause mental health issues. So we're going to transition over into mental health. So basically, we can start from the beginning. What is mental health, and why is everybody so afraid of it?
Yeah, well, mental health and mental wellness, or mental disease, behavioral health diseases, gets a bad rap. We think of people who we call crazy and we talk about, right? And who may act, strangely to us or whatever. But really, mental health and mental wellness is really what we need to focus on, right? How are we? When I talk to patients, I ask them, I said, do you feel happy most days? Do you wake up and you feel happy? Because that would be sort of like mental wellness. I feel pretty good today, right? And if we focus on that, and we don't feel that kind of just happiness, let's talk about it. Let's remove the stigma of mental disability and mental illness. Remove that stigma so that we can have a conversation about it. Because really, there are many people, up to 20% of the adult population suffers with mental illness, and that can be simply mild depression. I don't feel good. I feel blah. I don't want to do anything. If I ever spoke to another friend, never did, I'd be fine with that. That can be a form of mild depression. Or we think of mental illness as maybe someone with bipolar or someone with schizophrenia that has thoughts of hallucinations, either visual or auditory hallucinations, and can have paranoia, right? And I think that if we recognize that, and I want you all to think out there in your own families, most families deal with this topic. And if you don't have it in your own family, you probably have a friend or someone close to you who has someone who has battled mental illness at some point in their life. It may be something simple as that sadness and depression and not wanting to do anything, or it may be something along the spectrum of schizophrenia to bipolar. But what we're learning more about mental illness, and I think because we recognize now that there is actually chemical imbalances in the brain. No one chooses to feel that way. So if we recognize and we think about it like hypertension or heart disease, right? No one chooses that. Or we think of it as any other disease, then that would remove the stigma of mental illness from our society. And because there are so many people who I always say suffer in silence because they think they're the only one that may be going through that feeling that way, then they lose their quality of life. And so even in this time of this pandemic where people are feeling isolated, or our seniors, haven't been able to see their grandchildren, or just, not be able to have visitors or anything, there has been an uptick in behavioral health, telehealth needs and visits because of what people are going through. But just to speak on some of the warning signs that something could be wrong, right? Because this is Mental Health Awareness Month as well. We should be talking about this all the time, but for sure around this time. So if you're feeling sad, if you're feeling like I want to see anyone, I'm fine, I don't ever want to talk to my friends, that can be a sign of depression, right? From Are there any changes in your behavior, right? If you live with someone and you're seeing changes to their behavior, such as doing more risky behaviors, maybe going out, if we were going out and staying out all night, or drinking more, alcohol, or using any alcohol or drugs, that would be a sign as well. To drastic things like hallucinations, like wanting to feel like you want to end your life or harm someone. Those can be warning signs of a mental illness. But even it's so important that people don't feel like they're suffering alone and that that's the way things need to be. I think a lot of people, because you may have been feeling a certain way your whole life, it doesn't actually seem to you like anything abnormal. And that's why we have certain screening tests in the medical community. One is just a two person test, a 2-question test. And it's one of the questions is, over the last 2 weeks, have you felt depressed, down, hopeless, right? And then the other question is, over the last 2 weeks, have you felt lack of motivation to do activities that you don't want to do, things that normally would bring you pleasure to do? And those 2 questions are screening tests for depression. And so if any of those 2 tests, those 2 questions give a positive answer, then we as providers then go the next step to ask some additional questions about that. So hopefully providers, when we're even getting back in the office, are doing that screening. But even in this time of the pandemic, when people may be feeling sad, depressed, anxious, worried, all of those things that we all are feeling on one level or another, I encourage you to talk to someone. That could be making sure you're reaching out to friends. If you feel so down that you don't feel like you want to do that, and you know there's a change, take action. Reach out to the telehealth number that your insurance has. And then there's also a 1-800 number from the National Alliance on Mental Illness. I want to give that out as well. If you are in need of resources to find a provider, that National Alliance on Mental Illness number, the helpline, is 1-800-950-6264. That's the 1-800-950-NAMI, N-A-M-I, but it's 1-800-950-6264. That is a 1-800 number that if you are in need of help, that you can reach out to find resources to help you. But we wanted to touch on this topic because, again, this is one of these silent diseases, silent killers that no one, kind of like high blood pressure, that no one would know that you had that disease, right? No one would know that you had high blood pressure. No one would know necessarily that you were suffering with feeling sad or blue or anxious. And those things left untreated can become more disabling to our quality of life. As you say, ReShell, we come in this one body, this one temple. I'm so passionate about making sure that people understand that because we have one life here on earth, let's make the most that we can of it, and not let shame or embarrassment stop you from getting help if you need it, right? And for those friends, if you are recognizing some changes in behavior, sadness with your friends, with your family, take note of that. Try to understand why they may be feeling a certain way if you are privy to that information, and then make a connection with them and try to help them get help if needed. But all of us should be aware of that as well, right? If you know someone that's had a change in behavior, that's not acting their normal self, and we're finding even now that people who had been doing pretty well with their medications, if they were being treated for a mental illness, because of the stress of what we're all going through right now, those symptoms may not be as controlled as they once were. So we want to recognize that and help, if it's a family or friend, help them to get the help that they need, making sure they are taking their medications, or do they need additional counseling support as well in this time. It's so important.
Dr. Michelle, do you think that with COVID-19, with the pandemic going on, do you think that it's hurting some of those who are suffering from mental illness? Because I know with the telehealth. I mean, some of them may want to see the doctor in person. They may not want to do it that way. So do you think that it's hurting those who have mental health issues?
Yeah, on some level. So I know a lot of insurances have brought in the ability to get telehealth services, right? And even though they can't be in the office with someone, they can still see them. They can do FaceTime. So sometimes that helps, right? Which certainly I think, especially for behavioral health therapy, it's important to be able to see your therapist, right? And for them to see you, to see visually how you're doing and all of that. So I I think that, yeah, access is always important. I believe, and that's why I gave out that number as well. If you don't have insurance, or you don't have a provider, or you don't know where to turn for help, that you can utilize that 1-800 number, and they can probably steer you in the right direction. But we know that the COVID has caused more people to who maybe have once been, managing their symptoms, to have more symptoms. And some people need even additional medication if needed, or to speak with someone.
Well, we know that there's a lot of myths that come along with mental illness. So I just want to take an opportunity to try to dispel some of those. So one of them is mental health only occurs in adults.
No. Unfortunately, there are lots of children. I was just looking at a statistic. I don't have it in front of me. That lots of children, yes, 17% of our youth experience a mental health disorder. That's what I wanted to pull up. And so it can be any age. And so we even have to be aware of that too, to be to understand that even our kids right now are feeling anxious and depressed because of COVID, right? And to acknowledge what they're feeling, as we started talking about in the beginning, about our children, but understanding that they feel a certain way, that they're feeling anxious and down because of what they've lost with not being in school, and allowing them to talk about it. And not just, saying, no, you'll be just fine. Talk about how you feel.
Yeah, I mean, their feelings are important, even though I call them little people. Their feelings are important. And, we got to try to find a happy medium with everything that's going on. Cynthia Flowers said she shared this on her Healthy, Wealthy, Wise Movement page.
Awesome.
She said it was some great content. So thank you, Dr. Michelle.
Thank you. Yes, thank you, Cynthia, for sharing.
And another myth, Dr. Michelle, was the mental health problems make the people with mental health problems are more violent and unpredictable.
No, not necessarily. Not necessarily. There are some of the mental health diagnoses that, for example, schizophrenia, if they're feeling paranoia, right, that someone is, coming to get them or something like that, then they act out, right? And so, but not all mentally ill people are aggressive or anything like that. And that's why it's important that if you notice changes in behavior to someone who normally was not, that we get them help immediately.
Awesome. So the next one says people with mental illness cannot hold a job.
Oh, no, not true either. They absolutely can. They absolutely can. And especially if they get the help and the treatment that they need, they can function and have full productive lives, work, family, everything.
So the next one says mental health problems result from character flaws, personality weaknesses, or a lack of discipline.
Yeah, and I think that's where that stigma came from. We know that is not true. We know that there's actual chemical changes in the brain that cause this, right? And certain medications help to balance out those chemical changes, dopamine, serotonin, that then allow them to feel normal. I always liken it to like diabetes or, or high blood pressure, right? Things are not in balance, and we need to treat that with medication to bring things back to normal. And when we do that, then, we feel better.
Awesome. So here are, while I'm reading the 7 things that you should know about mental illness, Dr. Michelle, I want you to gather some words of wisdom about mental health.
Mm-hmm.
So the first thing says, mental health are real conditions. So just like you have a physical condition, a physical illness, mental health is just as real as that. It's not a personal weakness. Don't think that somebody is weak because they have a mental illness. It's that mental illnesses are dysfunctions of the brain. So it's something that they have no control over. Everyone is different. Each case is unique. All individuals are unique. Even though some may have the same diagnosis, they may have a total different treatment plan. If you know someone who has a mental illness, then you should be treating them with compassion, respect, understanding, encourage them, and support them as well. Awesome. So I can't believe we knocked out 2 big ones tonight.
Oh my goodness. Time flies.
It did. Stroke and mental health, which are things that are, both of them are plaguing the African American community. And I just want to make sure that we give out information. If you have the knowledge, then take action with what you know. Don't sit on the knowledge. So Dr. Michelle, give some words of wisdom about mental health that someone can take away and be encouraged.
Yeah, thank you. So I was just listening to what you were saying, right? So mental health is a real condition that is dysfunction in the brain that can be treated so that you can feel better and live a full functional life. Don't suffer in silence. There's others that are having similar symptoms to you. And because it's a real condition, we should talk about it, share, screen for it, like we screen for diabetes, high blood pressure, and all the other real conditions in our healthcare system.
Awesome. Thank you so much. Again, I appreciate your wisdom that you always share with listeners, and I'm just excited to have you on my team.
Thank you. I am grateful and thankful to be here every 3rd Monday with you.
Wow. Awesome. So if you have topics that you want Dr. Michelle to talk about, please put them in the comments or send me an inbox so that we can make sure that we are meeting the needs of the listeners and making sure that we are all making healthier lifestyle choices. And like Dr. Michelle said, baby steps. So take baby steps and you will be surprised where you would be a month, a year from now. So thanks again, Dr. Michelle. I appreciate you, and I will see you the 3rd Monday of next month.
Sounds good. Take care, everyone.
Awesome.
Bye-bye.
Thank you. Bye-bye. All right, you guys, thank you for tuning in. I appreciate it. Cynthia, thank you. If you have any topics that you want her to cover, let me know. We will definitely do that, and I'll make sure I tag you in it. Mark, thank you for tuning in. Vernita, Mary, Henry tuned in. So we will be here next Monday at 6 p.m. again, live on Intellectual Radio. And I want to leave you with these words of wisdom. It says, healthy is merely the slowest rate at which someone dies. So again, meet me next week here at 6 p.m. right here on Intellectual Radio. Stay tuned for Talking with Tone. He always has some amazing thought-provoking topics that get your mind turning. So as always, I will see you next week. This is Warriors Talk with Lady ReShell, where we are changing lives one warrior at a time. See you next week.